intermittent fasting and when you should do what, or if you should do any, like what is the expert's opinion here? Because you're probably one who knows most about this.
Yeah, so first of all, I always say I hate the word intermittent fasting because it doesn't mean anything. I mean, intermittent fasting goes from I haven't eaten for 2 hours to I haven't eaten for 2 months.
Right.
And it goes from I haven't eaten anything at all, or I had lots of food in a fasting mimicking meal.
Yeah.
So yeah, it doesn't mean anything. So we need to move to what exactly did you do? Or what exactly should you do?
And I think people are referring to like time-restricted eating, where you eat within an 8-hour period.
Yeah. So if you look at time-restricted eating and the work by Sachin Panda, but if you look at all the data, you would say that say 12, 13 hours of fasting per day are very good. That's and normal. Very safe.
Yeah.
Well, it's normal, but nobody does it anymore. If you look at Sachin's data, it'll show the average is about 15 hours. And I think this average of 15 hours, it comes with this idea that you should eat 5 or 6 times a day. So now, to eat 5 times a day, you're stretching the amount of hours. And so when he did this study, and they just asked people, you just mark down when you eat. It was 15 hours. It was not 12. So now I think if you went, in fact, when they went back to 12, people start doing a lot better. Now, the argument is, well, what if you go down to 6? Could you do even better? Or 8, let's say, hours where you eat and the rest of it you fast. Well, then you start seeing, A, not too many people in history did that, and B, you're starting seeing the problems. And the problems include gallstone formation, and the problem include many, including our own trial, our own study, epidemiological study, people that skip breakfast, they usually do worse. And understandably, you can argue that there is other reasons for that, but that's not a good start, right? So I would say if you keep it 12, 13 hours, seems to me like it's a good way to go, and it's very safe. There is really no negative association with even the 13 hours that I've seen. Maybe a little bit slight increase in gallstone formation, but it's very slight. When you get to 16, 18 hours, then you start seeing twice as much risk of gallbladder removal. Not the nicest thing that could happen to you.
No.
So that's the thing. So yeah, so there is all kinds of fasting.
And then what about ketogenic?
So ketogenic diet. Again, what does it mean? Does it mean that you're going to do it for a month? Does it mean that it's going to be low protein, high protein, animal-based? So again, we're ketogenic. We got to move away, in my opinion, to the word and move into what do you mean? Right? Just like medicine, any drug that you take, say, it's a drug that generally blocks the cholesterol pathway. No, it doesn't work like that. It's like, well, exactly what does it do? And show me the data on thousands of patients, et cetera, et cetera. So here, I think we need to say, in my opinion, a little bit higher fat, ketogenic, not ketogenic, but certainly I think the 60-30-10 is an ideal diet for all time. So 60% carbs, mostly from vegetables and legumes, 30% fats, mostly from olive oil, nuts, and fatty fish.
Yeah.
And 10% protein, mostly from legumes and fatty fish. That seems to be ideal, not based on my opinion, but really going around the world, looking at the basic research, looking at the clinical trials, et cetera, et cetera. Now, for specific uses, I think that the ketogenic diet can be modified, be more extreme, right? So if you have somebody that has, overweight, obese, all kinds of other problems, that's where I see that, let's say a much higher fat level, a much lower carbohydrate level being very useful to get the person to where they need to be.
That's over 2 billion people on the planet.
Exactly.
It's a lot of people who are in this country, it's 50 to 70%.
Yeah. So the question is that reasonable and is it safe for, and how should you do it? Let's say an 80-10-10, right? That could be a possibility. So 80% fats, 10% protein, 10% carbs. But how long can somebody stay on that? How long can they stay on it? And how long do you want to keep them on that?
Yeah.
without risking them getting into the epidemiological data, clearly showing that low-carb diets, if they're animal-based, they could be detrimental. And I know we disagree on this, but I mean, that I'm just thinking, I think it'd be good to come up with things that we know, and that's what I try to do with the book. Come up with things that we know there is no way it is bad for you.
Yeah.
I mean, I came up with this denominator where, like, there is no way. I don't care what they need to, like, 200 years of publications to say that this is why. Because the centenarian is one of the pillars. These guys have been doing this for over 100 years, and in different parts of the world, and they
eat real food. They don't eat a lot of sugar.
They eat real food.
And starch.
And that's a recommendation, right? So if you do that, then you're for sure in good shape. Now the argument could be, who's going to be able to do that? Okay, then we say, well, what's the second best that people can reasonably do? I think it's reasonable to eat a 60% vegetable and fish and legume diet. I think it's reasonable to have 30% fats. And if somebody cannot do it only from vegetable sources, whatever you can, add some animal sources, that's okay. And 10% protein. 10% protein is, to most people is 50, 60, 70 grams of protein a day. So it's not that low. And I think...
but even in your own work, in your paper in Cell Metabolism, you sort of talked about how there's a benefit when you're younger, but as you get older, you need more protein for building muscle. And you need, significant amounts of, like, for example, more protein that you talked about would be 2 cups of yogurt or 5 ounces of nuts or,
Yeah, so more protein and more variety. I think we were talking earlier about Emma Morano and the fact that the doctor, Carlo Bava...
There's a woman who lived to be 117 years old in Italy.
117, that's right. So she was already eating 3 eggs a day from earlier in her life, and then when she turned 95 to 100, Carlo put her on 100 to 150 grams of raw meat per day. But lots of times journalists talk about that, and they forget to mention that she started when she was around 100 doing this, right? So at 100, that, which is very bad if you were 45, it becomes, I think, not a bad idea at all. And I never thought, when Carlo told me that, her doctor told me that, I never thought, are you crazy? And it's a funny story, actually. She went to him one day.
And you knew her. You hung out with her.
I used to go 2 or 3 times a year. And it's a funny story. She went to Carlo one day, and she said, Carlo, I think I need to stop eating meat. And he's like, why? And she said, a journalist came to me, and he said, oh, you eat meat every day. This is going to give you cancer. And she was, I think, 107. But I thought it was very entertaining, right? And also very telling of the very naive approach in nutrition, right?
Sort of
this guy is telling a 107-year-old to worry about eating less meat. And he's a journalist, because she's going to get cancer. He's not thinking, no, she's not going to die of cancer. She's going to die of pneumonia. She's going to die because she breaks her hip and she falls down the stairs. Or maybe the flu. She might die of the flu, right?
She's past the age of getting cancer and heart disease.
Well, she might get cancer, but I mean, that's okay. You really need to worry about lots of things in addition to cancer.
Because the frailty is an issue.
The frailty is an issue, and the frailty of the immune system is an issue, right? So immunosuppression. If the immune system is weak, then you're going to have all kinds of problems, right? So this is why I think you and I are now, and a few others are now moving into sort of generating this field of complexity. And I think historically it was ignored because people said it's food.
Right.
What the hell could it possibly do to you?
Right.
And now
it's the most powerful drug on the planet.
It's the most powerful drug, but it's very complicated, and the response is very complicated. So now it's probably one of the most complicated fields in medicine,
Absolutely.
Right? Because the food is thousands and thousands of components, and the body's got thousands and thousands of genes, and now all these get together, and that's where nutri-technology word comes from. It's like, what the hell happens when all this happens?
When you think about it, you've got 20,000 genes, but about 5 million variations in those genes, all affected by food. You've got, the microbiome, which is 100 times as many genes as our own genes, which is another 2 million genes that get affected. And you've got the chemical reactions in the body that happen every second. And most people don't know that there's 37 billion, that's 21 zeros, chemical reactions in the body every second, all of which interact with food. So that's just mind-boggling. How do you even do the math on those numbers of what's actually happening instead of a single pathway, a single drug? And that's the beauty of food and why it's so effective. And I want to dig into this complexity a little bit with you, because the protein issue and the protein story is fascinating. In your models, there's a gene that gets activated, or a pathway that gets activated called mTOR. And this pathway seems to be activated through protein, and it seems to accelerate aging. When you're older, you need more protein. But like Emma Morano, she had 150 grams of raw meat. Why didn't that make her age faster if the protein activates mTOR?
Yeah, so it's actually what we call an axis. And the axis is multiple pathways joined together. So it starts with growth hormone, releasing hormone, growth hormone, IGF-1, AKT, TOR, or possibly TOR without AKT. So there is a whole series of genes that are involved. And what happens is during aging, they go down naturally. So if you're 25 years old, IGF-1 is going to be very high. If you're 90 years old, IGF-1 is going to be naturally very low. So what we showed in the paper a few years ago is that if you put an adult younger than 50 on a high protein, mid protein, low protein diet, IGF-1 and as a consequence TOR are going to be associated with the level of proteins. Okay, so high protein, high IGF-1, high TOR. Low protein, low IGF-1, low TOR. If you look at a 65 and older person, you no longer saw any significant difference.
Really? So, either high or low protein, there was no change in the mTOR or the
trend,
IGF.
But no significant difference. I mean, overall, you cannot say that there is a change no matter how much protein you eat, right?
So stay away from a lot of meat when you're younger, but once you hit 65, you can have the grass-fed steak. Is that it?
That's what a journalist will say. And that's what exactly what journalists say, at least some of them. So the idea would be that as you get older and older, you can measure your IGF-1. And let's say that you're 72 and your IGF-1 is 280, you should lower your protein.
And that's a measure of growth hormone.
Yeah, insulin-like growth factor 1, right? So the one that they're circulating is pretty stable, right? So it stays stable in the blood, so it's better than measuring growth hormone because growth hormone is pulsatile and it's very hard to follow. But IGF-1 now, most clinics can cheaply measure it. And so if somebody is 72 and has got 280 IGF-1, they're eating too much protein.
Yeah.
And so you can still knock it down. And these people are at risk for multiple cancer, prostate.
So where should you be?
You should be, we see the ideal level 140. 140 seems to be ideal. Whether you're young or old, now it could be very old that it may not be that easy to keep 140. But in general, in the adult population, 140 seems to be ideal.
But exercise increases that, right?
No, exercise does not have a big effect on IGF-1 either way, either up or down.
Fascinating. So, in the research, you're really talking about some really interesting things like Alzheimer's. So, how would this approach benefit Alzheimer's?
Yeah, so a few years ago, we published on the first paper on how just the essential amino acids. So if we took mice, they had mutation, human mutation to develop Alzheimer's. So all these mice develop Alzheimer-like symptoms. They become cognitively impaired. They don't learn anymore, and they do very poorly.
So they're mice that can't find the cheese.
Exactly. And so if we alternated if we affected IGF-1, this growth factor, and we make it go up and down by controlling just the essential amino acids. So these are the ones that you need to have to have a normal function, right? The ones that people
eat protein for. Those are the building blocks of protein, the amino acids.
So let's say, we'll just simplify by saying, let's say we have the high protein, no protein diet alternated. high protein, no protein, high protein. And we saw that this was sufficient to reduce their cognitive impairment and to keep them protected for longer as they were getting old. So now we're doing both multiple mouse studies and a human clinical trial in Europe, a USC, multiple mouse studies with two different Alzheimer model. One is called triple transgenic model. It has 3 different mutations that promote Alzheimer, early Alzheimer in humans. And then we're doing another mouse model called ApoE, mouse model for Alzheimer. And so we'll see. But our hope is that because the fasting mimicking diet, revolution, and by the way, the Alzheimer one is a very special one where we do it only once every 2 months because we're worried about frailty and we're worried about muscle loss. So we do it every 2 months and we give them for 55 days, actually for all the days of the month, we give them a ketogenic supplement. So we're pushing the ketogenic state and we want to ensure that they don't lose weight. But we also want to give them the benefits of the extra ketogenic chronic push.
Yeah.
So,
which is important because, when brains are damaged with Alzheimer's, that basically it's like type 3 diabetes in the brain, and it can't utilize glucose or sugar as well, but it can utilize fat or ketones, which is why you see patients in the studies show, and I've had my own personal patients significantly improve when they have cognitive decline when you put them on a ketogenic diet.
Yeah. The problem that we saw in our early approaches was the frailty. So if you take an 85-year-old and you put them on a ketogenic diet, you might end up seeing him pass out the day after, right?
Yeah. So, well, you need to get enough fluid and salt.
Yeah. So it's tricky. So we're thinking about as you get it out there as a treatment for everybody. I mean, not everybody has Mark Hyman following them, right? So in that case, I think you can experiment much more on things that are more extreme. And I'm not saying, I think eventually, there's already studies that are being published on ketogenic diet and Alzheimer, and I think eventually there's going to be ways to do it that are safe. The question is, how long can you keep a patient on that diet? And how frail are they going to be after 2 or 3 months on that diet? So those
those diets increase muscle mass, increase body fat. All right, they activate.
Yeah. The question is, pathways. If you took, let's say, 200 85-year-olds, and this is going to be really what you're looking at, or 80-year-olds, and then you put them on this ketogenic diet, how many problems are you going to see? And is it possible that if you just do a much lower ketogenic and maybe alternate it with the FMD every 2 months, you get the same effects? I don't know. Maybe not. Maybe you need to put them on a 90% fat diet, and so those are the things that need to be determined. I was always very afraid, and I know the neurologists in Europe and in the USC were very afraid to take people with close monitoring and putting them on a, say, 90% fat diet, revolutionize their diet, because they're all were saying, not with my patients. So, there's the same war that we had with oncologists.
Listen, by the time someone's got Alzheimer's and they're going downhill, it's a desperate time, and doing desperate interventions sometimes can have amazing results.
We're in the same choir, right? We're in the same choir. But when we first did this with cancer patient, it was a war. I'm talking screaming wars with oncologists.
Because they tell them, eat pasta and eat tons of ice cream and have cake.
We just published in Nature Reviews. We just published in Nature Reviews Cancer. And immediately after the publication, the complaint from the nutritionist in cancer centers.
Oh, yeah.
And the complaint was official and said, but in the standards in the European Association of Nutritionists and Dietitians says this, at least 1.2 grams of protein per day should be between 1.2 and 2, on and on and on. And we responded and we said, look, if you look at the days where chemotherapy was first approved, chemotherapy did tremendous damage. Forget the restriction of protein and restriction of fat. It did incredible damage and even killed a lot of people. Doxorubicin, for example, has severe cardiotoxicity.
Sure.
And we approved it. Why? Because everybody agreed that it was worth to have some side effects, even they could be potentially deadly, which is not the case for the diet. And everybody agreed. And you don't hear any oncologists complaining about chemotherapy and say, why are you now saying that we're not allowed to even test? And the words we had used was potentially promising. They attacked the potentially promising, officially with a letter to Nature Reviews.
Unbelievable.
Potentially promising intervention. What we were trying to do is stimulate clinical trials, and they managed to go after it. And so this is the world we live in.
Yeah, it's called, there's a great book called The Structure of Scientific Revolutions by Thomas Kuhn, where he talks about the idea of normal science. The normal conceptions and views and theories are very hard to overturn because people are stuck on their old way of thinking. And when someone comes out with a radical idea like you are, I'm sure you get a lot of attacks.
Yeah, and so I'm saying for the neurologist, exactly the same, right? But we already knew, we had learned from the oncologists. So we came in very careful, said we don't want to get in words. Let's try to get in there with real data, mouse data, human data. Let's collect preliminary and then say, look, they're fine. So now with the ketogenic, let's push this 400 calories a day, I think it is. And see what happens. If they're fine, then maybe we push it to 800 calories a day and combine it with the FMD. So, and then we'll see the results of other trials that are being done on Alzheimer, and lots of groups are doing that. And then we decide. I think it's a good way to do it.
This is a radical change in our thinking about medicine, which is that we can treat the underlying mechanisms of diseases that are all linked together through a simple common pathway, which is food. And certain types of eating that actually activate all these healing pathways.